session really is about starting to think about, apart from the implementation and spread that the rest of the national team have, and we've just spent some time discussing, is, and this term reusable network does sound a bit unusual if you haven't actually come across it before, although it has been in the documentation. But really what we're talking about here is, from my perspective, is that we've spent the last 15 months and going forward actually building your teams, building connectiveness between the teams and right across the country. We've been sharing learning, we've been sharing our failures, we've managed to, between us all, actually create an environment that is truly a learning environment, and one that those DHBs amongst us that portraying, I guess, to be learning environments could probably envy, because as I stand here before you, I'm actually really humbled by the fact that you're all really willing to share what has gone wrong as well as what has actually worked. And that's really exciting because, of course, although you hear some of those and have seen some of those slides about, before every success there's lots of failures, and that of course is true, but most of us, it's human nature to actually try to hide what we've managed to stuff up, and I'm one of them, underneath the table, and hope that nobody actually notices. So for you to have the courage to come and share those things is absolutely phenomenal, and will be one of the largest things for us as a national team working with you going forward about how we actually do really sustainably try to keep our patients safe in hospital. So using those networks that you are creating, how do we keep those in place going forward once the collaborative as it in its current form comes to a conclusion, really? We've managed to build teams that actually are truly interprofessional teams. We've managed to broaden the medication safety arena out past the walls of a hospital pharmacy into bringing nurses and doctors and patients, consumers, into the arena. And it's just a bit of a challenge so that we actually manage to maintain that flow, and that actually as you start to work on other projects that you can bring that connectiveness forward. But in this particular context, what I'm really wanting you to do is think about, in the medication safety arena, how do we manage to keep that going and not lose the momentum and the ability that you have all brought to the table going forward, and then using that to spread the opioid bundle, because we will have one. I'm not sure what it will look like, but actually we will have one. But again, as I said, broader into the whole medication safety arena, really. And from that, then it's around building and maintaining that process. And from a Health Quality and Safety Commission perspective, how actually can we help support you do that? What role, if any, would that look like? So I really want you to, and we will have a bit of time for you to write that basically down. One of the things that Carmela really wanted me to emphasise with you going forward was that, is there a way, and each DHB, of course, by its very nature and population base is entirely different, but some of you do have medication safety teams and pharmacy and therapeutic committees. So is there a way to actually connect into those to make sure that the momentum, it's only one pathway, but is that a suitable pathway for you to follow, both at a local level and potentially a regional level and potentially a national level? But we just need to see what that actually looks like, and trying to align the work that you've actually done into whatever medication safety programs that your individual DHBs are actually participating in. I mean, you might think that this is it, because of course this is the medication safety one under the Commission umbrella, but if you think about the falls program, I mean, a lot of medications actually actively contribute towards falls. So is there a link in there? So it's just an example to get you thinking. Don't just think the narrow spectrum of drugs in a drug cupboard and administering them to patients. It's actually much, much broader than that. And just about 99.9% of patients that come into our hospitals for our care will be taking medicines. So just, how do we link all that together and not lose the gains that we've already made through all your hard work? really. So what we're going to do now is, so if just on your tables, we could just spend a few minutes for you to actually think about what that might look like, and we will gather them up as a national team towards the end of the forum, because we're really keen. We don't want to tell you what to do or how we think this might work. We want you to tell us how you think it would work, and then we can actually work with that. So we're trying to reverse the big brother effect, okay? And we're happy to help and bounce ideas, of course, but if you've got some thoughts, that would be really helpful. And we'll leave that slides up. So if we just have an absolute maximum of 10 minutes to do that, that would be fantastic. Thank you. Thank you very much for that. We'll come round and gather up those pieces of information and try to collate them with what your thoughts are. I'd now like to hand over to John. Yeah. And we will have some time for reflection after John has finished his little bit to continue on this kind of conversation. But John is now going to talk to us about what next. Thank you, John.
Thank you. I've been the phantom at the back of the room. That's what I felt like for the last couple of days, skulking around with a cold. But I'm glad I've persevered and stuck out both days. A lot of work goes into it, and I was very keen to hear everyone's sharing and everything about their work. So I'm just going to quickly go through next steps, and a little bit will be a bit of a recap on what's already been said. Oops. So you have been working on project documentation, and we'd appreciate it if you could go back into the beloved shared workspace and update those documents, including our old friend, the driver diagram. Please continue to test your interventions and your change ideas. If you do want further input regarding applying PDSA, please feel free to contact Prem. He's available 24/7. And as we've made it clear, the priority is about identifying interventions for the bundle. So a few teams have already shared that they think they have interventions that could be bundleised, but if you get to a point where your data is suggesting improvement, the bundle doesn't have to be done next year. We can start working on those elements straight away, so just get in contact. We do value the time and effort it takes in terms of uploading stuff into the shared workspace, and I'm just going to ask you to continue to do so over the next few months. There was a reminder sent out on Monday that last month's report was due this Friday. A lot of people have told me it's not going to happen, so please just do it when you can. Next week would be fantastic. And Janice mentioned it yesterday, and Avril just said it again. We are confident we will have a bundle at the end of the collaborative. We will share details about the bundle in the new year, and just to remember that the bundle will be based on the interventions and supporting data that you will provide. And once we know what the bundle is starting to look like, we'll start working on the implementation plan. And this plan will be developed in discussion with all of the teams, and it will also be based on what has been discussed over the last 2 days. So please watch the space. And I put a little thing at the end there about enjoying the summer. It's certainly been beautiful weather. It's got me in the mood for the beach. And I suppose we've been pushing this common theme right through the collaborative, that as a national team, Prem, Beth, Avril and I are there in whatever capacity is required to support your excellent work. The first thing we'll do is to take away the flip charts and various documentation and collate all of those materials. Somebody mentioned the pre-reading. I'm glad somebody read it all, or part of it, Barbara. We've got hard copies down the back if you want to take those with you when you leave. In terms of the storyboard material, most learning sessions it's been ripped down and whisked back to the DHBs and Mercy Ascot. Feel free to leave it here if you want to, but a request that everything that's on the board, if you could put it into the shared workspace, we very much appreciate it. We've had one webinar to date. We did plan to have a few more. Ideas weren't forthcoming. We do have John Kruger waiting to do 3 more webinars, and there is time to do those. So based on what's been discussed today, we may do a webinar on spread and one on implementation, or maybe in a reverse order. But again, if you have any ideas, please feel free to send them through to me. I've already mentioned the shared workspace. If you have any problems getting into it or any dramas, please let me know and I'll do my best to support you. We have 2 more harm-based teleconferences scheduled in December and January, and the dates for the December have just come out, and I'll do one for January. It won't be the first week after Christmas. And the format from February will be confirmed in the new year. Face-to-face meetings can't underscore the value that I think those have brought to this collaborative. It's certainly helped us as a national team, and we've enjoyed coming around all the DHBs and visiting Mercy Ascot. The offer's there for more face-to-face meetings. I know it's difficult finding time, so if you want to do a VC, that's fine, or teleconference, but it really does help us understand where you're at. We always come away from learning sessions feeling much more informed, and those meetings are just part of that. So thanks again for creating the time for the visits to date. Today is the last time we come together as teams. It's possible, and I was just mentioning or talking with Alan, that we will probably have another wrap-up session in the new year at some point, wrap-up or transition session. It won't be on this scale. The budget won't extend to that, and we'd be interested to hear your thoughts about how you would like that formatted. But the intention is to try and resource that, because I think it's a very valuable exercise, especially when we get nearer the end of the collaborative. Finally, there's a newsletter coming out. They haven't come out as often as I has promised. Midland and Northland are going to be profiled in the next one, which will be pulled together quite soon after the learning session. We'll also have a piece in there from Synergia, the evaluators, to share what they've observed to date. If you have any other ideas about content, please let me know. So the final thing is, the national team are here for you. We're just a phone call away, so please feel free to get in contact whenever you feel fit. I feel like you need to feel fit. I don't feel fit. I'm going home to bed. Anyway, I got there in the end. So are there any questions about any of that? It's less involved in the last learning session. It's much of the same. Basically, we'll be in contact in the new year about the bundle and implementation. That's a take-home message. Prem. Yep, I mentioned that. Yeah, so that will be, we'll probably take a couple of weeks to pull that together, but we'll let you know when that's happened. Okay. There we go, you've already seen it. Thank you very much.